have declining cases, and one day we have 2, and then all of a sudden the next day we have 3. Does that start that 14-day clock
No.
over?
So we had a long conversation about this too. It's a general downward trend. And the other piece is adding the hospitalizations, because as Josh said, I think the hospitalizations are more indicative of where we are, simply because the hospitalizations aren't gonna change in the next month if everyone continues to stay at home. I think that's a better number than the total number of cases, because it's not a reflection of who's being tested, those are a reflection of who's actually critically sick.
And how many people are in a hospital in Washington County right now for COVID-19?
I don't know, as of last week, I think we had a total of 36 at one point, and that's for both counties. And I should say that my understanding is Hartford Hospital is not taking COVID-19 patients, they're all going to Grafton. So, and that's the other piece, we have three separate hospital systems that operate within our borders. And some have more capacity than others, so it's not necessarily an accurate reflection of, but as of, I know at one point we had 24.
Okay, and then what is the efficacy of, we hear on the media a lot about how we as a society need to develop herd immunity, where a significant number of us have antibodies, so the disease has nobody to spread to. What's the efficacy? Have they studied this concept of herd immunity with this disease yet?
So herd immunity is just a concept that it runs for all diseases. It's the same concept, for example, measles, mumps, all of the diseases that we have vaccine for flu, essentially. The idea is that when we have herd immunity, people are less likely to become infected. One of the issues, for example, with whooping cough, I don't know if anyone follows disease patterns, but whooping cough, for example, has made a resurgence in the United States because we have gone below the threshold of herd immunity for whooping cough. It's particularly dangerous for young children, infants. But we have seen now we are below herd immunity because people just haven't been getting vaccinated. And there was a point in time when the vaccine potentially wasn't as effective, so it didn't last as long as we thought it did. So we see spikes in late middle school students. So that's a concept that across disease since we started thinking about immunology. But it is something that we need to consider, and I think that the herd immunity piece is particularly important when we think about the most vulnerable populations. So those people who are older and have underlying health conditions, they're at highest risk. And so unless we have herd immunity, the restrictions on that population in particular is probably going to remain the most strict because we want to protect it for as long as we can, or until we have a vaccine available.
Well, thank you for all the questions. A little bit later this morning, we're already a little past what we thought we would be. We're going to do something similar for the press. Both myself and Kirsten, and we're inviting the sheriff to be part of that. I just want to say that I know this is extremely frustrating time for a lot of people, being some who are literally cooped up in one room, others just not being able to go out and do normal things. That being said, the intent of this plan is really to try and help thread a needle. For all the talk about let's just flip a switch and let everybody go back to doing what they're doing. Look, the President of the United States put out a plan that isn't all that far off from what this plan is. The President has acknowledged it. The President started everything off on the right foot. Safer at Home has worked, there's no doubt about it. And we've lived under it, and I think for the most part, Wisconsin has done a great job. Now, the governor puts out a plan with an arbitrary date that has no metrics tied to it, tries to tie some yesterday, I guess. This plan is trying to thread a needle between the two and something that can work and work locally. We urge our partners across counties all across the state of Wisconsin to do something similar, because I know for a fact, friends of mine up in Chippewa County and Eau Claire County have stories of one case in the entire county. It's a totally different ballgame up there. Kewaunee County, my home county, where I was at high school living, they have just had their first case last week. So it's completely different for them. But this is intended to thread a needle between the President's plan, which is very generic across the entire country, and everybody knows state by state it's different, and the governor's plan, which is locking down an entire state, carte blanche, blanket approach, and instead saying, we've got a handle on things. You just heard we have 2 out of our 4 criteria are already met. So the minute, our intent, my intent, is the minute that we get to achieving the other 2, that we begin to talk about how are these other things beginning to open. If we live under the order as it exists now, that's extraordinarily difficult. We need to have flexibility, and we need to give people hope, and that's what we're trying to accomplish with this plan. So, Mr. Chairman, thank you for the opportunity with the county executive report, and I defer back to you.
Okay, seeing if there's no other business, we stand adjourned.